So topical minoxidil is one of the most frequently used agent, but when you apply the minoxidil, it converted into human scalp to the minoxidil sulfate, which is the active form of the minoxidil. If most women can use the 2 to 3% of minoxidil for the topical use. If you use 2% of minoxidil, about 1/3 is included visible hair, and 1/3 increases small hairs, but the 1/3 those has no improvement at all. But the problem is the side effect. Irritation, which is about 80%, is due to the propylene glycol, and the hypertrichosis happen in about 5%. These two side effects are most disappointed portion of the topical minoxidil. There's a new trend in minoxidil treatment. In women, the previously 2 to 3% of minoxidil for 2 times a day is the classical treatment, but nowadays 5% minoxidil once per day treatment is a standard regimen. Okay.
Thank you. So, good evening, everyone. My name is Li-Hsuan Chen, and I'm from Taiwan. Today, I'm going to talk about hair transplantation for female pattern hair loss. So female pattern hair loss used to be called female androgenetic alopecia, but because of its unclear association with androgen and the genes, so it is now preferably called female pattern hair loss. It is by far the most common cause of hair loss seen in both sexes after puberty. So there are 2 peaks, the 3rd and 5th decades. Right now, the only FDA-approved treatment is topical minoxidil. Other treatment modalities include oral finasteride, dutasteride, spiral.
In my experience, a good indication for hair transplantation is the advanced stage of male or female pattern hair loss, but non-advanced stage of female pattern hair loss, or the patient have the poor donor density, it is contraindication for hair transplantation. So we can consider SMP in this case of the patient. So what is SMP? SMP is a kind of tattoo, but different from the conventional tattoo in the body and eyebrow.
Right. And sometimes that we in doing FUE techniques, we have to be a little bit wider the area that we extract to get enough number of grafts. I think those are the factors that affecting the recipient area and donor area shock loss. But I see a lot of patients, even in the area that we didn't even do anything, next adjacent to the recipient area, close to the donor area, they are still shedding. I still have to find out what is the exactly cause. But I usually now mention this issue to the patients before doing hair transplantation, because in women it's not acceptable. I mean, can acceptable, but they have to prepare their mind, right?
So where was the most frequent area, like a temporal or?
Yeah, in temporal area, it's quite.
How many percent in your experience?
It depends. I think around 50%.
Around 15, 1 5.
Yes.
Wow, it's a great number. Okay.
Have you experienced that, Dr. Tommy and Dr. Roy?
Mm-hmm.
Any other speaker experience a lot of shedding?
Mm-hmm. So you should increase your artistic view.
Yes, yes.
Great.
I think it's very difficult because you know, for most of the male surgeons, actually they don't have enough experience to see the hairline in details. Only you can see yourself, your hairline, right? So you can see your hairline every day, so you know what the beautiful hairline is.
Your wife. That's your wife.
Okay, I'll do that.
Can I ask a question? Yeah. Ask Dr. PANCHAPRATEEP a question. Since you said a lot of most of your female patients receive topical minoxidil before hair transplant. How long after do you restart them on topical minoxidil?